it's Dr. Jan Roberts here from A Smile Above. I'd like to show you a case here that involves 12 porcelain crowns that were done to treat tetracycline stain. So here in this slide you see Kim before treatment. Kim is self-conscious about her smile due to the severe tetracycline stain. The upper teeth have been treated previously by another clinician, but the lower teeth still exhibit severe staining and do not match the uppers. So even though the top teeth have been treated, Kim is still not comfortable smiling broadly, as you can see in these photographs, as her lower teeth are still very dark and discolored compared to the top teeth, and they show when she smiles. So here we see a retracted view of her teeth before treatment of the lowers. The severe tetracycline stain can be seen on the lower teeth. Tetracycline stain is the severe and unsightly discoloration that can affect both deciduous or baby teeth and the permanent teeth. It is caused by ingestion of the antibiotic tetracycline during the mother's pregnancy for deciduous teeth or during childhood for permanent teeth, and this is while the teeth are forming. In some cases, the upper teeth, in this case rather, some of the upper teeth have already been treated with porcelain crowns, but the lower still exhibit the dark brown banding that is typical of severe tetracycline stain. Here you can see the porcelain crowns that have been placed on the upper teeth previously, and you can see here that the lower teeth are still untreated, and there's a marked discrepancy in color and overall look between the two. Here, the 12 lower teeth have been prepared for crowns. We've decided to put full crowns on these teeth because, as you can see here, the dark discoloration has penetrated very deeply inside the tooth structure, or is still very deep inside the tooth structure. And full thickness crowns are often required, not always, but often required, so that there's a greater thickness of porcelain available to block out the very dark discoloration. You can see a shade tab here in the photograph, and it's being used to communicate the color of the underlying tooth structure to the ceramist. The ceramist then knows what color they are starting from in order to build out to create the desired final shade. In this photograph here, you can see another shade tab being used to communicate the color of the upper teeth to the ceramist so that she can match the final color of the lower teeth to the upper. In this case, the upper teeth have been covered in a very, very light shade of porcelain, so it's important that this is communicated to the ceramist and they know what the color is on the top so we can match it on the lower. Here is a photograph of the lower provisional or temporary crowns in place. These are put over the prepared teeth to protect them while the porcelain ones are being made in the laboratory. The provisionals here are made out of plastic, and this plastic is much more translucent than the final porcelain will be, and you can see how much less able this translucent plastic is to block out the dark color of the underlying tooth structure. And you can see this especially down at the gum line of the lower front teeth where the material is the thinnest. Here's a photograph of the final lower crowns in place, and you can see how now they match the uppers and how much more confident Kim is in smiling. She's able to smile without thinking about covering up her lower teeth. Here's a retracted photograph showing before and after of the treatment of the lower teeth, and you can see now that the dark discoloration has been covered up and the lower teeth match the upper. Again, a before and after of the lower teeth. And here you can see in a smile photograph how much more confident Kim is of smiling. The corners of her mouth turn up. She's not trying to hide the dark lower teeth. Again, here in a partial facial photograph, you can see how much more easily she's able to smile. So here is Kim after. She's much more confident now, and her smile shows it.